Okay, today's article is from the Sunday Times, and it's from last Sunday, which was the 1st of June 2025. Okay, the National Health Service, that's the public health service that we have in the UK, the National Health Service has a vaccine problem. Staff don't want the jab. Almost 90% of employees at One Health Trust, so that's doctors and nurses, rejected the offer of a flu vaccination last winter, putting patients at greater risk of infection. So 9 in every 10 doctors and nurses are rejecting the flu vaccination. Why on earth would they do that? Doctors, nurses and other frontline NHS staff, that's National Health Service staff, are shunning the flu vaccine in ever greater numbers, with almost 9 in 10 staff at one of England's largest hospital trusts unvaccinated last winter. If you shun somebody, that means that you purposefully ignore that person because you don't like that person anymore. And usually you shun people. But you could also shun a vaccine if you don't take it. And I think a lot of people have been shunning the vaccine. And as we're learning in this article, doctors and nurses, the experts, are shunning the vaccine. Okay, Barts Health Trust, which has more than 18,750 staff working in 6 hospitals in each London, had the worst results in England, managing only 12% or 2,416 frontline staff getting vaccinated. This includes nurses and doctors working at the Royal London in Whitechapel, a major trauma centre, treating some of the most seriously injured and sick patients in the capital. The dire take-up, and look, we've seen uptake before, but you can say take-up or uptake. The dire take-up is symptomatic of a problem on NHS wards across England. New data shows the number of NHS staff getting the seasonal flu vaccine over winter has crashed to 37.5%, its lowest level in almost 15 years. This year's drop of 5.3% is the 4th consecutive year that vaccination rates have fallen since the pandemic. The flu vaccine is essential to prevent widespread sickness in hospitals. A bad flu season can lead to tens of thousands of deaths, particularly in elderly patients and those already ill with other conditions. More than 22,500 excess deaths were linked to flu in the winter of 2017 to 2018. An outbreak can also lead to staff shortages, cancelled operations, and put patients at risk of being infected by staff who are meant to be caring for them. I don't really like that because you've got noun phrase, and then verb phrase. So it's not parallel and it sounds quite jarring. The rapid fall is another sign of the wider phenomena of vaccine fatigue that is being blamed for a rapid decline in vaccinations, including those designed to protect children from deadly diseases such as measles. The UK Health Security Agency, so that's some kind of secretive agency that encourages us all to take vaccines, the UK Health Security Agency said there was also complacency about the threat of some diseases, and the agency was working to make sure parents were educated about the risks of not vaccinating their children. Okay, and here you see that vaccination rates in various places, and as you can see, less than half of the doctors and nurses are taking their vaccine. I wonder why. Okay, last week it emerged efforts to eradicate cervical cancer in England by 2040 were at risk of being derailed because of a crash of 17% in children getting vaccinated against human papillomavirus, or HPV. The number of NH staff getting vaccinated is very low. It is worrying, said Heidi Larson, a professor of anthropology and founding director of Vaccine Confidence Project. So she's an anthropologist who tries to persuade everybody to take a vaccine. And she is founding director of this Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. It tracks public sentiment towards vaccines and has been running since 2010. Larson said vaccine fatigue, it's an interesting word for when people don't want a vaccine, but vaccine fatigue and wider falls in vaccination rates were being seen globally. Okay, so this is happening all over the world, but particularly in Europe and Western nations. It's a mix of things going on, she said. Since the pandemic, people had reacted against a sense of being controlled and forced to have jabs. Whatever gave people that idea? That's weird, isn't it? Societal post-traumatic stress disorder. That's what those letters mean. They mean post-traumatic stress disorder. It's the kind of thing soldiers have, having come back from wars and having seen awful, awful things. A lot of people were kind of bullied. That's an interesting word, bullied. But in a positive sense. So there you go, there's a positive form of bullying that I have never heard of. But a lot of people were kind of bullied in a positive sense to get the first COVID dose in the UK. It was very successful, so the coercion worked. But there was this sense of control, and people have said in our studies they resented taking the vaccine. It sounds like some of the doctors and nurses resented taking the vaccine. Some people, maybe subconsciously, are angry about having been pushed into taking them, having been pushed, having been coerced. Isn't coercion illegal, especially when it's a drug that you're coercing onto people? They feel enough is enough towards vaccines. What I see is a sort of societal post-traumatic stress disorder, and within that, some people are now saying they won't ever get vaccinated as a reaction. The pandemic has also made more people aware of vaccines and the science behind them, and prompted more people to go online, where, Larson said, they were confronted by toxic information. Urgent action was needed to reverse the decline, but she warned the NHS and government against a top-down command and control campaign, sounds quite coercive to me, which could make matters worse. Instead, more nuanced conversations using peer influencers, so YouTubers I suppose, and community leaders were needed.